Hi, my name is Dory Smith, and today I'd like to talk to you about the 7 known causes of autoimmune disease and how to fix them. So I was a research scientist for about 13 years in the field of autoimmunity and environmental toxicology. I did my PhD fellowship at the NIEHS, and I also worked at Duke University Medical Center for a time when I decided to do something a little bit stupid. I decided, well, I'm working on autoimmune diseases, why not just get my own? So unfortunately, I came down with scleroderma and fibromyalgia. It quickly progressed to arthritis, thyroiditis, polymyositis, and then Addison's disease and IBS, which we later found out was Crohn's. And so the conventional dogma that I was taught as a scientist in is that, okay, you have autoimmune disease, we really don't know the cause, we really don't know the cure, there is no cure, and basically there is no hope. So as the illness progressed, I lost my career as a scientist. I became disabled and I lived on Social Security disability for well over a decade. I was on a cocktail of about 12 to 20 different medications at one time, including 3 really powerful painkillers. I went through multiple treatments and hospitalizations, and I really felt like I was coming to the end of my life when I pretty miraculously found the science of functional medicine. And that gave me my very first spark of hope. Because you see, I had a really important reason to keep living. I was raising my granddaughter by myself, and I was all she had. So what I'm about to show you is not my own work. I'm just a scientist who had a really important reason to live. Conventional medicine had failed me, and I really had to find an answer for myself to my illness. So literally from my sickbed, I had the time and the training to do a very thorough, comprehensive literature review and really a little meta-analysis of other people's work in order to determine what really works to reverse autoimmune disease symptoms. And let me tell you, the kind of person I am, I just totally geeked out. I studied all of the top names in functional and integrative medicine, including Dr. Jeffrey Bland, the father of functional medicine, Dr. Joseph Pizzorno, the founder of Bastyr University, Alessio Fasano from Harvard, who is the well-known leading researcher in the study of gut health now, Dr. Dale Bredesen, the leading researcher on the study of Alzheimer's and dementia. I studied all the work and case studies of doctors and educators at the Institute of Functional Medicine and many, many, many more. Now, I can't say that I have done a completely exhaustive research study, but I think it's pretty close. And what I learned from these experts' work is really changing and really revolutionizing the way that we look at autoimmune disease now. Because truly, there are literally hundreds of thousands of cases of people who have reversed their autoimmune disease. And I'm one of them. In the last 2.5 years, I have reversed my autoimmune disease by about 90%, and I'm still getting better. I have my life as a scientist and a health educator back, and I am looking forward to not only raising my own granddaughter, but seeing my great-grandchildren as well. So I'm about to make a very profound statement to you. We now know, without a doubt, that autoimmune disease is not only reversible in many, many cases, but it's actually preventable. Autoimmune disease is no longer this mysterious conglomeration of diseases without a known cause and without a fix. We can give people their lives back now. And so now, as you can see, I'm very passionate about my mission in life. And that's to help doctors and patients alike to have this roadmap to reversing autoimmune disease. So what I'd like to do now is I'd like to show you how. So if you give me just a moment, I'm going to share with you. There we go. Now you should be able to see my screen. So what we have here is we have the big picture. Let me just make this large for you so you can see it better. There we go. That's what I wanted to do. Okay, so the basic big picture to reversing autoimmune disease starts with the genetics. We used to think that our genetics were fixed in stone and there was not much we can do about them. But now, because of the Human Genome Project, now we know that that's not true. We know that it's our genetics plus our environment that causes our epigenetic expression. And if we put our genes in a good environment, that leads to the expression of health. And if we put our genes in a bad environment, it leads to the expression of inflammation and oxidation, which we all now know is the cause of most, if not all, chronic illness. So this leads to the huge revelation in the patient's mind that, wow, you mean that if I can control my environment, that I can control my illness? And of course, the answer is yes. We do have control over our symptoms, many of them, most of them, by the way we live. And that gives us this powerful spark of hope, because we need that spark of hope in order to be compliant with the nutritional and the lifestyle changes that we absolutely have to make in order to get well. So how do we change our environment and get well? Well, we have to test for and correct the 7 known causes of autoimmune disease. And honestly, there's probably more, because we know that we can't completely 100% reverse 100% of every patient, right? Even when they're perfectly compliant. So there are other details that science has not yet discovered, but today, this is the best we can do. And it's pretty darn good. We can really give people their lives back with what we know now. So here are the 7 known causes. It's gut microbiome dysbiosis and the leaky gut, the intestinal permeability that comes with it, genetic predisposition and the SNPs and how they're expressed in our environment, mitochondrial dysfunction, food sensitivities and allergies, invisible infections, which are the bacteria, virus, mold, yeast, parasites, toxic overload, which it's now considered that most of us have this. And of course, this nice big long nerdy word that I love to say, psychoneuroimmunology, basically just means trauma and stress. So let me show you. Let me just make this smaller so that you can see it better. There we go. Now, admittedly, okay, I'm sorry, I'm a scientist. I like to make really busy slides, but this is the way it had to be in order to take all the information that I have learned and narrow it down into one small piece of paper for you that you can follow either as a patient or as a practitioner. So this slide is going to show you the 7 causes, the testing that we use in order to find if they're there in a specific person or not, and the correction that we make to help them to get well. And what you'll see here is that the gut microbiome dysbiosis and the intestinal permeability or leaky gut that comes with it is absolutely critical to fix in order to get well. You'll look over here, the correction of all 7 of the causes start with gut healing. If we don't heal the gut, we don't get well. That's the bottom line. But thankfully, it's pretty easy to find the specific problems that are in each person's gut and to turn them around. So we do a test. We do either a Viome or something like it, Genova testing, right? In order to look at the intestinal dysbiosis, the gut microbiome dysbiosis. And then we use targeted nutrition and supplementation, right? Typically, we prefer to use herbals because herbals have this wonderful tendency of attacking the bad bugs in the gut while oftentimes leaving the good guys alone. And that's basically what we want to do to heal the gut. Next, we have our epigenetic expression and mitochondrial dysfunction, which those two kind of go together because the test is the same. We do just a regular genetic testing, typically by 23andMe or a company that does health genetic testing. And then we send it up to Strategene, which is Dr. Ben Lynch's lab, for analyzation. Dr. Ben Lynch is the well-known genetics expert. And so his lab does such a great job, makes it easier for the rest of us who aren't genetics experts. So then how do we fix that? Once we find the SNPs and once we find the mitochondrial dysfunction and exactly what's causing it, like say we find the MTHFR or we find the COMT SNPs. So we know specifically that people are not methylating properly. How do we fix that? We fix that with targeted nutrition and supplementation. Then we move on to the food sensitivities and allergies, which are very commonly present. Why? Because we have the gut microbiome dysbiosis and the intestinal permeability that actually causes the food sensitivities and allergies. And let me just say at this point that it's well known that wheat sensitivity is present in 80% of autoimmune disease patients, right? And it causes leaky gut in all people, according to Alessio Fasano at Harvard in his groundbreaking work. So we really do need to put people on an elimination diet with reintroduction of some foods after 6 weeks. But they really do need to do that. They need to get rid of any kind of wheat and oftentimes dairy, eggs, certain things that do cause inflammation. And we need to get their inflammation down in order to help them to feel better. Now, we can do that. We can do food sensitivity testing, but it does tend to be a little more expensive for people. And so we can do it with or without. It just does make it easier if we have that food sensitivity testing. Next, we have the invisible infections, and those can be found with blood testing, stool testing. And again, the fix is healing the gut, targeted supplementation with antiviral, antibiotic, antiparasitic, antifungal herbs, right? Whatever is specific for what we find. Toxic overload. We do various detoxification protocols. We wait until the person's inflammation has been knocked back somewhat with their nutritional protocol before we start detoxification. Otherwise, it can make them feel even worse and it can be even harder for them to remain compliant. So we do the detox protocols, and then if those don't work completely like we want them to, then we need to look at chelation testing to look for heavy metals and other things, and then do even more specific detoxification protocols that can get some of those out of their system. And the last one is the trauma and the chronic stress. So we don't really need a test for that because we know how people feel. You know, they tell you, okay, I'm having anxiety, depression, mood swings, sleeplessness, right? Those things we know are present. Why? Because we have gut microbiome dysbiosis, and we know that the gut is our second brain. Some researchers are now even saying that the gut is our first brain. And so how do we help people to fix that? Well, there's various therapies. First of all, we must fix the gut in order to get their neurochemicals working properly, right? We can teach them active stress reduction techniques such as deep breathing, stretching, exercise, right? Even minimal exercise for very sick people can really help the gut to heal and to help that stress. And then of course, there's different relaxation therapies, counseling, and lifestyle practices that people can learn. So at this point, you know, you're probably thinking, wow, that's a lot for a patient to do. They really have to be committed. And it's true. They must make the necessary nutritional and lifestyle changes in order to reverse their illness. And again, we don't do people any favors by telling them that they can just kind of do this halfway. It's not going to work. We really need to help them put both feet in and walk a very specific path if they want to get well, and we know they do. So how do we do this? And we do this with a health coach. And that's what I do now. I have left the bench. I no longer want to be just working with cells at a bench. My heart is in helping people to get them out of bed and to get their lives back again. And so that's the job of a health coach and a health educator now. We need to bring people hope and empowerment. The health coach needs to be someone who has been in their shoes, who has been sick, and who has gotten well and knows the path to better health. Because that way we can walk them through it, and we can do it with love and non-judgmental encouragement, which that presence of love and community is like one of the most powerful healers that we have to work with to help people to be compliant and to get well. So that's what I do now. I partner with doctors, and I partner with people. I work with people all over the world through Zoom video conferencing, and I basically just teach them how to walk this path to getting well. And I help doctors by helping their patients to be compliant. So if you have any questions, I know this was a very short, very quick video, but you can always get in touch with me at truewellnesstoday.net. And I'm happy to answer all your questions. So the last slide I'd like to show you is my beautiful granddaughter. She was 3 when I was diagnosed. She's now nearly 14, and I think she's going to have her grandma around for a long time to come. So thank you for your attention. Bye-bye.